Hello, my name is Jamie Gary. I am the owner of UpVision Consulting LLC. We are a full service legal nurse consulting firm, and we are the host of the Attorneys Resource Conference, or as you are hearing it, ARC and ARC 2026. So, the Attorneys Resource Conference is a venue for you to come to improve your strategies in case litigation, improve your professional practice and outcomes for patient care, and improve your ability to identify and mitigate risk. We are here today with Dr. McCarthy. And before he takes the stage here to introduce himself, I would like to draw your attention to our website at attorneysconference.com. Also, the QR code in the bottom of our screen to scan and register for your seat to hear Dr. McCarthy and all the other fabulous presenters at the conference this year. So, welcome, Dr. McCarthy. We are excited to have you speaking this year. Can you tell the audience a little bit about yourself and what type of work you do?
Yeah, well, thanks for having me. I was born and raised in Michigan. I did medical school. I did undergrad here. I did residency here in Michigan. So I have a lot of strong community ties, and I practice locally as well in what's considered a level 4 epilepsy center. So that has full capabilities for epilepsy evaluations, EMU, additional diagnostic studies like a magnetoencephalogram, and then we do epilepsy surgery or planning for patients to get there. I myself do not do the neurosurgical aspect of it, but we do from the epilepsy standpoint, working people up to get to that point. And we take care of a lot of medically refractory epilepsy patients. And then I also do medical legal consulting in regards to mainly epilepsy, but some other neurologic conditions as well.
Okay, so in regard to ARC 2026, what drew your attention to accept a presentation spot for us this year?
Yeah, so I attended last year because I thought it would be a great place to do some connecting and see what other people's perspectives are, especially from like a nurse legal consultant perspective and an attorney perspective, and that was very helpful. And I thought that's a great community where I'd want to present something. So when that opportunity was offered, I jumped on it because I figured that's a great place to kind of start showing my face and letting people know what I do.
Great. We're looking forward to your presentation. I hear that you do a nice job with presenting, so I'm excited to
Thank you.
hear I'm excited to hear your topic and your background in neurology and epilepsy. I think will be an interesting presentation for both attorneys and medical professionals. So, can you give us a little snapshot, just a brief synopsis to entice the audience about your presentation?
Yeah, so I'll be presenting on uh, driving and epilepsy. So it's a common lifestyle issue with patients who have the condition, epilepsy or seizures, and it prevents them from driving in states, depends on the state, but it's generally 3 to 6 months. And that's your personal license. I'm not going to delve deeply into commercial driver's license just because that's a different beast and different time frames. And I'll be using a specific criminal case that I was a part of where I was asked to do a review of the medical evidence to see if there was any reasonable proof that they were trying to control their seizures and that this particular episode was just a fluke. Because some people can be driving and with epilepsy. So they have the condition, they have seizures, but they're controlled on seizure medications and they're past that 6 month mark and they haven't had anything. And their neurologists, and in the state of Michigan, we're a non report state. And by good faith, we take them on their word and we say, yeah, if you're at that 6 month mark, driving is completely fine. But in some cases, people are behind the wheel with epilepsy, and then things happen. And if there's medical documentation with that and counseling that happened, and still like, accidents happen, it's, has a lot of significant litigation fallout from that.
Sure. I would think there'd be a considerable amount of risk in this area. So, why is this topic then? You sort of address the importance of the topic, but what is the risk if we don't address this topic?
Yeah, so the risk is that these people, if there is a reasonable demonstration that they were taking their medications, following up with their neurologist, filling their scripts at appropriate times, all of that points in a direction that they were within reason well controlled. So if they're facing litigation because of their diagnosis, being able to say, hey, the evidence shows that they were doing everything right, then it keeps them out of prison, keeps them away from civil penalties. But then if you have a case where somebody was not doing that, there's appropriate repercussions for that. Because in some of those cases, they end someone else's life or other people's lives. Um, and if, it can be something that either changes that epileptic's life or is devastating. And if it's devastating and complete accident, we can direct attorneys the right way and juries the right way. Or if it's not, we provide evidence as to why there was poor faith and poor evidence to defend that person, the epileptic.
Sure. So, as an attendee, how do you want us to think or feel or act differently as a result of your presentation?
Yeah. So, at least from my perspective, when I started, I was under the impression that everything would be in the medical records. But not everything is in the medical records. I think that one thing um, we don't often realize is that there are police interviews if something is criminal, and there can be a lot of important details that come from that. And then also pharmacy records. So when they're filling their scripts, how often they're filling it, if it doesn't match with the recommendations from their doctor. So all those moving pieces, it's important to kind of line it up and understand what the overall picture is.
So then what do you identify as the most misunderstood part about your topic?
That anyone with epilepsy shouldn't drive.
Okay. Okay. So, and that seems pretty straightforward. That
Yep.
does. So, who should be in the room? Who do you
I
think should
think
be in the room?
legal nurse consultants, certainly if they're the ones that do a lot of medical review and guidance for attorneys, attorneys should be in the room. Other community neurologists, if they take referrals from places for medical expert work and it's a question about driving with epilepsy, there's a lot of finesse that also goes with that.
Okay, so as we look ahead to August and our excitement for welcoming you to the stage and presenting to our audience this year, what are you most excited about?
I'm excited to get up there and kind of put my teaching hat on. Um, and like talk through my thought process. It's a little bit of a mix of uh, medical expert work and also some forensic neurology. So I think that's something I'm excited about too, and just kind of want to get out my name out there as something that I'm interested in and can help with.
Okay, you're going to be a great resource for a lot of people. So I would like to thank you for taking time to watch our video and to welcome Dr. McCarthy to the stage in 2026 at the Attorneys Resource Conference. To guarantee that you have a seat, take time to go to attorneysconference.com or scan the QR code in the bottom of my screen and get your seat today. We would be very happy to welcome you in 2026. Thank you.